As a dietitian in residential care, it's really important to make that connections, whether it's connection with the residents, families, and the team. And the communication is so important. I need to find out more about the resident. I need to go and talk to them. I need to see them at mealtime, see how they eat, what's their ability, any difficulty, any food preferences. That's where I see them. Because a lot of them, because of their cognition impairment, quite often they don't even remember what they just have about 5 minutes ago. So it's important for me to see them in action, when they're eating and how is the ability and what's the preferences.
There are many clinical challenges in terms of the disabilities that we see, dementia, strokes, and how they impact somebody's muscles and how they work in terms of food. Being able to bring the food to the mouth, being able to chew it and swallow it safely is something that Kit and I work really closely together on.
In residential care or any healthcare, I think it's really important to really individualize the person. And I think being a dietitian, I am very privileged to be in a position that I can use food to connect with them socially, emotionally, and culturally, and at the same time use my skill and knowledge in nutrition to make the best nutrition care plan for them to make them well and or maintain their health, or even to just make them feel well and balanced.
I've worked closely with Kit for many, many years, and in the last couple of years we've really had an opportunity to work even closer with doing a research project around how people feel when they first come to residential care, their admission and that process. And I just have a lot of admiration for the way Kit does things. She has a very gentle presence, and she works very, very hard, and I wanted to acknowledge some of that.
One thing I must say about Kit is she's a great proponent, advocate for our Eden philosophy of care here in residential care. She actually led our Eden team for many years here, and I was always amazed at her creativity to make the residential experience for our residents more human and I guess more home-like. So it really just shows her ability to empathize with our residents and her caring spirit.
Kit is a person who has a vision of something that is truly patient and family-centered care. And her way of leading is to bring forth the qualities of all team members, and she does so what we imagine is actually comes into existence.
I'm very fortunate to work in Langara because I have just an amazing team, really capable and compassionate colleagues that I can work with, that we can communicate constantly to plan for the best care plan for the resident.
Kit, I think you have really taken it to to another level, and just to make sure that we're not just feeding the right diet for our residents, but food and love are so much intertwined, and so you have really lived that psychology of love and compassion through your profession.